Hello and welcome to the module Norovirus Prevention, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about norovirus. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, Norovirus Prevention, is the second module of 2 exploring norovirus. You are viewing the second module of the series, which provides information regarding strategies to prevent and control norovirus. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you should be able to identify norovirus prevention strategies and describe the best practices for norovirus control. As discussed in the first module, norovirus is the leading cause of vomiting and diarrhea and foodborne illness in the United States. People of all ages can get infected and sick with norovirus, which spreads very easily and quickly. Norovirus causes approximately 21 million illnesses each year. It is the leading cause of illness and outbreaks related to food in the United States. Symptoms start between 12 to 48 hours after being exposed and can last anywhere from 1 to 3 days. Individuals with weakened immune systems, chronic disease, and the elderly are more prone to serious or prolonged illness. Healthcare facilities are particularly at risk for the norovirus outbreaks. There are several practices to prevent norovirus illness, which include correct hand hygiene practices, safe food preparation and handling, thorough environmental cleaning practices, appropriate laundry practices, and staying home when experiencing nausea, vomiting, or diarrhea. When caring for a person with suspected or confirmed norovirus, wash your hands often with soap and water for at least 20 seconds, especially after toileting others or yourself, before eating, preparing, or handling food, before giving yourself or someone else medicine, and before and after removing personal protective equipment. Hand sanitizer does not work well against norovirus. You can use hand sanitizers in addition to hand washing, but hand sanitizer is not a substitute for hand washing, which is best. Norovirus can be found in vomit or feces even before someone starts feeling sick. So it is important to continue washing your hands often at all times, even after you or a patient or resident is not showing any symptoms of illness. The virus can also stay in feces for 2 weeks or more after you feel better and can still spread during that time. It is essential to handle and prepare food safely. Before preparing and eating your food, wash fruits and vegetables well. Cook oysters and other shellfish thoroughly to an internal temperature of at least 145 degrees Fahrenheit. Routinely clean and sanitize your kitchen utensils, counters, and surfaces. Be aware that noroviruses are relatively resistant to heat and can survive temperatures as high as 145 degrees Fahrenheit. Quick steaming processes may not heat foods enough to kill noroviruses. Food that might be contaminated with norovirus should be thrown away immediately. Personnel who work with, prepare, or distribute food must be excluded from duty if they develop symptoms of norovirus. personnel should not return to these activities until a minimum of 48 hours after the resolution of symptoms or longer, as required by local health regulations. Perform routine cleaning and disinfection of frequently touched environmental surfaces and equipment in isolation and cohorted areas, as well as high-traffic clinical areas. Frequently touched surfaces include, but are not limited to, commodes, toilets, faucets, hand and bed rails, telephones, door handles, computer equipment, and kitchen preparation services. After someone vomits or has diarrhea, always clean well and disinfect the entire area immediately. While doing so, you should wear rubber or disposable gloves and wipe the entire area with paper towels and throw them in a plastic trash bag. Disinfect the area as directed on the product label. Leave the bleach disinfectant on the affected area for at least 5 minutes. Then clean the entire area again with soap and hot water. Wash laundry well. Handle soiled linens carefully without agitating them to avoid dispersal of the virus. Use standard precautions, including the use of appropriate personal protective equipment such as gloves and gowns, to minimize the likelihood of cross-contamination. Immediately remove and wash clothes or linens that may have vomit or feces on them. While doing so, ensure you wear rubber or disposable gloves and handle items carefully without shaking them. Wash the items with detergent and hot water at the maximum available cycle length, and then machine dry them at the highest heat setting. Wash your hands after with soap and water. Double bagging, incineration, or modifications for laundering are not indicated for handling or processing soiled linen. If there is a suspected or confirmed case of norovirus, it is important to follow the prevention strategies just discussed, as well as a few other things. Isolation and cohorting those with suspected or confirmed cases of norovirus gastroenteritis. Communicating the presence of suspected cases to infection preventionists. And wear the correct personal protective equipment and follow the recommended precautions. Patients or residents with symptoms consistent with norovirus will be placed on contact precautions. Contact precautions include placing the person in a single room if possible, using personal protective equipment appropriately, limiting transport and movement of patients outside of the room to medically necessary purposes, using disposable or dedicated patient care equipment, and prioritizing cleaning and disinfection of the rooms. When patients with norovirus cannot be accommodated in single occupancy rooms, efforts should be made to separate them from asymptomatic patients. Depending upon facility characteristics, approaches for cohorting patients during outbreaks may include placing patients in multi-occupancy rooms or designated patient care areas or contagious sections within a facility for patient cohorts. Timely communication to healthcare workers and visitors when an outbreak of norovirus is suspected should be provided with information about what needs to be followed to prevent further transmission. In addition, if an outbreak of norovirus gastroenteritis is suspected, appropriate local and state health departments will be notified by the appropriate person at your setting, as required by state and local public health regulations. Rapid identification of norovirus is extremely important to prevent the further spread of the illness. Reporting a change in condition is an essential component of prevention and/or prompt treatment for any disease. The following changes in condition require immediate notification to licensed staff. Any symptom, sign, or apparent discomfort that is acute or sudden in onset and a marked change, such as more severe, in relation to usual symptoms and signs, or unrelieved by measures already prescribed. In the case of suspected norovirus infection, be sure to notify licensed staff immediately if a patient or resident has nausea, vomiting, stomach pain or cramps, watery or loose diarrhea, feeling ill, low-grade fever, and/or muscle pain. Congratulations! You have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Norovirus Prevention Quiz on the Frontline Forces webpage or in the YouTube description below.